Okay, in our video series on infectious medicine, in this video, we are going to talk about dengue fever. We are going to discuss that what is the presentation and diagnosis of a patient with dengue fever. We are going to discuss that how do you treat a patient with dengue in hospital and in outpatient department. First of all, dengue fever is a viral infection caused by dengue virus. Dengue virus is an RNA virus of genus Flavivirus, and it is transmitted by the mosquito Aedes aegypti mosquito. Aedes aegypti mosquito has characteristic white and black stripes over it. Now coming to the clinical presentation of dengue fever. Dengue fever is usually divided into four different categories. Dengue without warning signs, dengue with warning signs, severe dengue, previously called as dengue hemorrhagic fever, and dengue shock syndrome. Now, not all patients go into all these phases. Majority of the patients develop dengue without warning signs and they are better after a week. But few patients who are not managed properly or the patients who are immunocompromised and the immune system is weak, they can progress from dengue without warning signs to dengue shock syndrome. So in this video, we are going to discuss all these categories in detail. How do we divide patient into these categories based on the symptoms, as well as we'll treat these patients according to these categories. Now coming to the first one, dengue without warning signs, in which the majority of patients present. In dengue without warning sign, this phase lasts for the first 7 days after the onset of symptoms. Whenever patient gets bite from Aedes aegypti mosquito, there is usually an incubation period of 4 to 10 days in which patient is not having symptoms. And after that 4 to 10 days, patient starts to develop symptoms, and those symptoms last for 7 days. That is dengue without warning signs. Patient will be complaining of high grade fever up to 40 degrees centigrade. And if the patient has two of these things, severe headache and retroorbital pain, patient would be complaining that doctor, whenever I look on the sides, I get severe pain at the back of my eyes. And patient will be having myalgias, arthralgias, severe muscle pain, joint pain, which is called as breakbone fever. Remember, all these viral infections, they have classical myalgias associated with it. These viral infections have severe muscle pain associated with them. And other than that, patient will also be having typical joint pain associated with it. Other than that, patient